Dr. Leah Prestbo is the medical bone health director for Avera Health, and she helps with bone diseases like osteoporosis.
Osteoporosis is a condition that causes you to have an easier time breaking bones than the average person would. What we typically see is that osteoporosis isn't something you really have symptoms of until you end up with a break or a fracture.
Osteoporosis is correlated with estrogen levels, and Dr. Prestbo says women, specifically postmenopausal women, are more likely to develop it.
Now, for women, when they go through menopause, we lose all of the estrogen or a lot of the estrogen that's available to us, and we see a steep decline in the bone mass right after that.
However, men can develop osteoporosis too, as it can be genetic, along with how much calcium you got as a kid, as Dr. Prestbo calls osteoporosis a silent disease, because you may not notice it until it's too late.
So we call fractures kind of two different ways, right? We talk about high trauma fractures and low trauma fractures. Now, high trauma fractures are things that, oh my gosh, you really should have broken that if you did that. Like you fall off a roof or you get hit by a car or kicked by a horse. Of course, we expect you to break bones in those circumstances. Those low trauma fractures happen when you really haven't done a whole lot to earn them, right? Maybe it's a cold, snowy day like today, and you walk outside, slip and fall on the ice and break your wrist or your hip, those kinds of things.
And once you develop osteoporosis, you have it for the rest of your life. To counteract this, there are medicines you can take along with a bone density study or DEXA scan to see if you have osteoporosis before you find out the hard way.
And you go and lay on a table, and it takes about 30 minutes from getting into the place. They ask you some questions about your history again, because that's important for assessing risk. And have you lay on a table. They take pictures of your hips, your spine, and sometimes your wrist. And that machine can analyze how dense those bones are. Okay, and that gives us an idea of what that T-score is, that will help us assess whether or not you have osteoporosis.
She also recommends yearly checkups with your doctor and telling your family history of osteoporosis.
If you have those kinds of individuals in your family history, important to tell your doctor about that because they may decide to screen you earlier with a bone density study for osteoporosis.
However, Dr. Prestbo says just because you have osteoporosis doesn't mean you still can't have fun and live your life.
Now, I will tell you that I don't recommend taking up kickboxing to any of my patients with osteoporosis. So we really going to want to avoid those high impact things and just be careful and cautious about our risk of falling. But that certainly doesn't mean you can't continue to do the things that you love in most cases.